Since 1966, this is NBC4's News Conference with Conan Nolen.
On this edition of News Conference, airline pilots go through it, so do train operators. But what about doctors? Should they be required to undergo random drug testing? There have been cases of physicians being under the influence while in the operating room. To combat prescription drug abuse, what about a database physicians can check to see if their patient is doctor shopping for medication they don't need but are addicted to? Or would that constitute a violation of a patient's privacy rights? And since 1979, there's been a law in California that limits the amount of money awarded in pain and suffering to victims of medical malpractice. That figure, $250,000, hasn't changed in nearly 35 years. Should it be increased? All three of those elements constitute Proposition 46 on the November ballot. Today, a debate on medicine, addiction, privacy, and justice. All part of what proponents have called the Troy and Alana Pack Patient Safety Act of 2014.
Welcome. Troy and Alana Pack were the children of Bob Pack, a backer of Proposition 46. He is one of our guests. Representing the no side is political consultant Teri Holoman. Thank you very much, both of you, for joining us. For clarity, this ballot measure is named after your children because they were taken years ago by a woman who was addicted to prescription medicine, correct?
That's right. My children and wife were out for a walk in our town of Danville in Northern California, and a driver drove off the road, striking all three of them and killing my two young children.
And that resulted in the ballot measure, Prop 46. That is one element of three elements. Since you're the affirmative here, we'll have you go first. Why should people vote for this ballot measure?
Well, this is all about patient safety, and it's about bringing needed reform that the legislature in California will not take on to protect patients in medical care from prescription narcotic abuse, and through allowing them to hold doctors accountable when victims are harmed.
In terms of the MICRA cap, that is $250,000 for pain and suffering, you want to lift that to what, $1.1 million?
Well, we want to raise it for the last 40 years of lost inflation and only adjust it for that inflation, which would bring it up to about 1.1 million.
Why is that important?
Well, it's important because for victims, $250,000 in 1975 is no longer the value of $250,000 today. And why that's important is because victims who are harmed, particularly children and stay-at-home moms and elderly who do not have high incomes, cannot get to court for $250,000. And therefore they're locked out.
You mean they can't find an attorney?
Well, they can't get an attorney because the cost involved in getting to a trial is too high and prohibitive for that $250,000. So the harmed victim, like my family, you get no compensation, you get no accountability, and you don't even get access to your medical file.
And the first element to the ballot measure is drug testing of doctors. Why is that important?
Well, that's very important because prescription narcotic abuse today is out of control. Every expert in the field has called it an epidemic, and doctors have easy access to narcotics. And the abuse rate has skyrocketed over the last 10 to 15 years. So drug testing doctors is paramount to providing protection and safety and acting as a full deterrent for doctors who are working on patients.
Teri Holoman on the no side. Let's pick this apart. What we just heard there, pilots require it, police officers require it. There's a stat that says that a certain percentage of doctors are addicted and have problems with alcohol. Why not drug testing?
I don't think it's a question of why not drug testing, Conan. I think it's this particular ballot measure and the way that it's written. For example, in this ballot measure, emergency room nurses are not required to be drug tested, but a hospital doctor who has admitting privileges as a psychiatrist is. It's not fully formed and it's not well thought out. They never consulted the medical community to find out whether or not this would work. There's some provisions of the ballot initiative that would require a doctor to show up within 12 hours of an adverse event. That's regardless of whether or not they're traveling or out of the country, whether or not they're in surgery, and if not, their license can be pulled by the medical board. The proponents have never come to the medical community and said, how can we work on something that will impact, that will effectuate change in drug testing.
We have a big problem with people who are addicted to prescription drug medication. Some would say it only makes sense that you would have a database so that somebody who comes and seeks prescription drugs can be checked, cross-checked to see if they're actually sick or they're addicted. What's the matter with that?
There's nothing the matter with that. As a matter of fact, the California Medical Association supports both financially and in principle the Cures database, which is the provision of the initiative that you're talking about for checking to whether or not to make sure someone is doctor shopping. The problem with it is that the way that this ballot initiative is written, it doesn't allow additional money for the people that are going to come into the system if this ballot initiative were to pass, and the people who currently administer the database, the Department of Justice, have said as recently as July 24th in a hearing with the California Medical Board that they, one, don't have enough money to maintain the database as it currently is. It won't be ready until July 15th of 2015, and it currently does not work. And so the way that this initiative is written, you would require doctors or put doctors in a situation where in order for them to prescribe drugs to a patient, they'd have to check this database. If the database is down, the Department of Justice has said it's slow and it freezes. If the database is down, they cannot prescribe to patients. If it's first-time patients, they cannot prescribe to them. The Pharmacists Association has said that they are counseling their members not to prescribe to patients if they cannot access the database to do a double check. And so it's not the intent of the initiative, it's the mechanics of the initiative and the fact that it's not fully cooked.
But you're opposed to the intent of one element of the initiative, and that is the hike in pain and suffering in medical malpractice cases. So that people understand, if medical malpractice isn't a mistake, it's not an error, it's practicing medicine at below the medical standard. And you can sue for damages,
correct,
the lost income, you can sue for your medical bills, but when it comes to the pain and suffering, you're limited at $250,000. That was a bill signed by Jerry Brown during his first term as governor. Why are you opposed to raising it to the cost of living where it would be at about $1.1 million?
I think that when you look at the coalition that is formed in opposition to this ballot measure, particularly the 116 clinics of Planned Parenthood affiliates of California, the California Community Clinics Association, the Rural Clinics Association, have all said that increasing that cap is going to negatively affect their ability to care for patients. Specialty doctors who are not covered by federal insurance, federally qualified clinics, specialty doctors will not be able to practice in many of the clinics. And these are clinics that serve about 5.4 million Californians. And so from that standpoint, there are some negative effects if you raise the cap. And in particular, it hits community clinics that serve women, those who are low income, and people of color.
Is it fair, though? I mean, for poor people who they can't get an attorney because they don't have enough money, and $250,000 is the pool that the attorney gets a cut of. So in many cases, they can't find an attorney to take their case. The argument's been made that the MICRA cap is discriminatory against the poor and blue-collar workers.
You know, I think it's a really difficult question. I mean, we're talking about, again, 5.4 million Californians, more than 2/3 of whom are women, more than 63% of whom live under the poverty level. Those are the people whose access to health care will be impacted should this initiative pass. When you talk about working men and women, I think that when you look at the support that's come behind this initiative, or on the no side of this initiative, from labor unions like SEIU and AFSCME, they have members that are part of the working poor in many cases, and they've analyzed this ballot measure and they've decided that the impact to those communities is greater if it passes.
We'll have a response to those points when News Conference returns, a debate on Proposition 46 on the November ballot. Welcome back to News Conference. Proposition 46 would require random drug testing of doctors, a database for the issuance of prescription drugs, and a raise in the limit on pain and suffering from $250,000 to $1.1 million. Bob Pack is with the yes side. Teri Holoman is with the no campaign. Teri just made a couple of arguments that, first of all, the technology is not there quite yet for the database that you want in the ballot measure, that pain and suffering, the MICRA cap, goes up past $250,000, it will be a problem for healthcare in California, particularly in rural areas and low-income areas. And plus, she says when it comes to the drug testing of doctors, it's all over the place. You're not testing nurses, you're not testing ER people. There should be some uniformity in that. Respond.
Well, today is the first time that I've heard the medical lobby, through Ms. Holoman, say that they are actually for doctor drug testing and they are for the Cures database, which only makes sense. The majority of Californians and the vast majority of doctors are for these two initiatives. So, but regarding
most doctors are in favor of getting drug tested.
Most doctors don't have a problem with drug testing because they want their own profession clean. They want to be able to demonstrate, just like pilots do, that when patients come in to see them, that they can guarantee that they're clean. And they want that from their own fellow doctors. There's just no mechanism in place today to do that. The CMA, the Medical Association lobby, won't do it, and the legislature has not done it, and the California Medical Board has no authority to do it. That's why it's in the ballot measure.
But it's also never been introduced at the legislative level. The proponents have never come to the California Medical Association or to the legislature, to my knowledge, and introduced a bill to pass doctor drug testing.
Was this not negotiated in the legislature? I know that the Senate President Pro Tem, the Assembly Speaker, they were on this program talking about coming together, at least on the MICRA proposal, and that the two sides never got together, which is why we're at the ballot.
Yeah, sure. I've helped drive this for years to the legislature. They will not take on the MICRA issue, and they actually voted down doctors checking the state's database. The CMA fought that and removed that requirement 2 years ago on the Senate bill. So, this is why it's in the ballot measure. No one is helping patients stay safe. Now, on the prescription drug database, it has $3.5 million in funding, plenty of money to make the database upgraded to accommodate the larger enrollment. And if doctors check it and can't access the data from a technical point of view, there's absolutely no penalty in the current law, and there's no penalty in Prop 46. If a doctor can access and check it, they just fall back on their own discretion.
That's actually incorrect. And what I would encourage.
Okay.
No, wait.
I'm getting upset because I'm getting interrupted.
I'm sorry, I thought you were.
No, he's directing the question.
Go ahead and respond to that.
The one thing I'll say is that I encourage people to take a look at the July 24th hearing of the California Medical Board, which they can find online, and they will see that the person who administers the Cures database has backed up every claim that our no side is making.
When we had the Senate President Pro Tem here and the Assembly Speaker, Darrell Steinberg was up front saying that the doctors were the ones not negotiating on this issue. He actually said that the trial lawyers and the others had put efforts on the table, and that it was your side that walked away from it.
And I think that was related specifically to MICRA. And again, I think that if you look at this from a historical perspective, there have been 37 legislative sessions roughly, and in each of those legislative sessions, they have upheld MICRA. The Supreme Court has upheld MICRA as a way to balance the needs of both victims as well as patients.
What the CMA lobby won't answer, and I'd like to propose that now, is if $250,000 was fair in 1975 on medical negligence lawsuits, why isn't that same amount and value fair today? It's what the medical lobby wanted and said worked for them in 75, and it's what the insurance industry said would work for them in 75. Maybe Ms. Holoman would answer, why isn't that same value workable today?
I think that when you talk to the community clinics and health centers that are most impacted by the changes to MICRA, they will tell you that they've seen corresponding reductions in their Medi-Cal reimbursements, Deni-Cal reimbursements.
See, she won't answer the question. She will not answer that question.
But let's go directly to that. We just have a minute left in the segment. But there's a woman at USC who went in for a medical procedure. She got her bowel nicked. That's not a problem. Fact is, you can't sue for medical malpractice if a doctor makes a mistake. Mm-hmm. But when she complained and said she had fever, they didn't check up on her. They sent her home. She came back. They did another procedure, which was completely opposite of what they needed to do. She ended up in the hospital 14 months consecutively, mm-hmm. and all limbs amputated, arms and legs, because of gangrene that set in. All because of a medical malpractice case. $250,000, that's it for pain and suffering. Is that fair?
In that case, look, We have victims in our own family of not medical negligence, but of, my grandmother was killed by someone who was addicted to drugs. So believe me when I tell you on a very personal level, I sympathize with victims. I think that when you're talking about something that will have the potential to impact as many people as this proposition does, again, 5.4 million people who seek their services from community clinics and health centers in California.
Okay, I think we've
we've
been over that point enough. I think
that you have to look at this.
To be answered is 250,000 fair.
I think you have to look at this.
We'll get to that when we come back. News conference next. We're talking about Proposition 46 on the November ballot regarding pain and suffering, as well as a database for drugs. More questions when we return. Welcome back to News Conference. Teri Holoman is the director of the No on Prop 46 campaign. Bob Pack is with the Yes on 46 campaign. Let's talk about the endorsements. Barbara Boxer's on your side in favor of 46, as well as the minority leader, Nancy Pelosi, a number of Consumer Watchdog, for example, a co-sponsor. On your side, interestingly enough, you've got two prominent Democrats for it and the California Democratic Party against it.
Yeah, California Democratic Party is neutral. It's the LA County Democratic Party that is against it.
And the ACLU.
ACLU.
Which has a privacy rights concern. Is that it?
Absolutely correct.
You've used that in a advertisement. Explain that.
So I think there's twofold concern from the ACLU. One is the random and suspicious drug testing of doctors is what causes some concern for them. The way that this initiative is written, this is not for cause.
They're opposed to sobriety checkpoints. I mean, they're opposed to all sorts
They are opposed particularly to random and suspicious drug testing, and they oppose it on the grounds of individual liberties for the medical community. But they also oppose this on the grounds that they believe it violates the single subject rule for initiatives, which means putting more than one issue into an initiative.
Is this a violation of privacy rights, the drug database?
Absolutely not. Oh, the drug database? Well, absolutely not. The drug database has been in operation fully since 1997, and even our California State Court and our California Appeals Court has upheld challenges by the medical lobby that it's not a violation of either doctors' rights or patients' rights when law enforcement or the Attorney General's office needs to check that database. So that's paramount and comes with prescribing highly addictive narcotics.
Now, the trial lawyers are with you, and the hospital insurance companies are on your side.
Doctors, dentists, and clinics as well.
And you've got a lot of money being poured into this. We're seeing, you might have seen some of the ads on this program in opposition to 46. We haven't seen a lot of ads for 46. I'm wondering, where's the support coming from for your campaign? Have the attorneys backed away from this?
No, absolutely not. This is a patient-driven initiative, and I'm the author of it. And I'm, as you know, I lost my two children, and I've been driving these safety issues for many years. Now, the opposition, if you peel back the onion, has $45 million from just a handful of medical insurance companies, malpractice insurance companies. They're the pink elephant in the room on this. You know why? Because they're the ones funding this heavy campaign, because they don't want to pay victims that are harmed from the medical negligence. That's it. It's a profit-driven business. And our side is supported by trial attorneys.
Which they'll say is they're also...
trial attorneys who will quadruple...
Excuse me. Don't interrupt, because I don't interrupt you.
Go ahead.
Trial attorneys are not a large organization. A lot of them are individual practitioners and small companies. And medical malpractice is just a subset of many of these attorneys who practice law.
We'll wrap this up. You have 45 seconds.
Certainly. Trial attorneys will stand to quadruple, in some cases, the amount of money that they make for medical malpractice cases if this initiative passes. But I do want to say this. We have one of the largest coalitions in opposition to an initiative in California ballot measure history. So as you said, the ACLU, the California Teachers Association, SEIU, AFSCME, Planned Parenthood affiliates of California, Community Clinics Associations of California. Yes, we are funded by the medical community, but there is a larger group that opposes this ballot initiative because it is bad for California.
You have the final word.
This is very paramount to patient safety, to the liberties of those that are harmed by medical negligence, to be able to have their rights to the court system and legal system, to accountability, and some kind of fair compensation when they're harmed. And without it, it goes on for another 40 years where harmed victims, you lose a child, you never get any justice or any compensation.
Bob Pack is with the Yes on 46 campaign. Thank you very much for coming. Teri Holoman with the No on 46 campaign.
Thank you.
The polling's out there. People can take a look at the polls. The election day coming up, and I appreciate your candor in this debate.
Absolutely.
Thank you
Thank
for
you.
coming. We'll have some final comments after this.